lot of emotional turmoil inside of me. And my background, I'm degreed in English and I'm a creative writer. And so I naturally start analyzing how I'm feeling, what I'm observing. And so I realize that what I'm feeling is magnified by how many other people are in this country. Then you start narrowing it down to our families. And so there's just a lot going on right now. The pandemic alone was a significant amount of change. And now we have the social change going on right now, or at least social events going on right now. And so what we're going to talk about today with Miki Jo is employee health and safety, or employee health and wellness, or employee health and resilience is really the key term here. And so all of us are feeling the same way. And so now we've moved from what I would consider probably more of a strategy and operations type of project in terms of change, and we'll talk about that. But now we're moving into the more emotional and mental health aspect of change, and we're affecting change. How is that impacting people? And so Miki Jo has a great toolkit as well as a great presentation to dive deeper into that. So glad you're here. It's going to be a rich conversation. I'll start though with the operations side of this. Yes, MJ.
I just wanted to let everybody knows here that we're not using chat today, and what we are using is Q&A. So at the bottom of your tray, you'll see Q&A. Any questions that you have, please put them in there, because that way they won't get lost in chat, and we'll be sure to address them when we get to the Q&A part. So that's all I needed to share. Thanks.
Great, thank you. So real quickly, just to set the table here, this is the agenda. So I'm going to talk 10 seconds about us, and then I'm going to get into some assumptions. As we start talking about the roadmap to return to the workplace, we need to talk about some assumptions as we're looking at the change. Then we're going to talk about planning and executing that plan. We're really now moving into the implementation of a plan, and then the tools to collaborate with all the various people you need to collaborate internally as an HR leader or as a business owner, as you're affecting change and putting in new practices for returning your workforce to the workplace. And so real quickly, just about us, our mission is quite simple. We provide responsive and resourceful experts in HR advisory, project management training, and talent acquisition. And we are a company that lives by our values. Our values are, we believe in honest solutions, we do what's right, we are resourceful, accountable, and we're about our community. And our community has given so generously to us over the last decade in business. We really saw this as an opportunity to give back to our community in developing these tools and this methodology to help you get organized as you go forward. Because as I've heard from many of you, there's really no playbook for this. We're developing a lot of this on the fly. And so that's where we thought we could use our expertise to help our community by developing a change management plan. So for what we're going to cover today, so I just want to make sure we're clear, we're going to talk about some assumptions about today's data, because I think all of you know the data changes regularly. We're going to look at a project plan that we developed to return the workforce to the workplace. Then we're going to review some collaboration tools that'll allow you to collaborate with your team in terms of getting organized. And then we're going to talk about or share with you some decision workflows, because when we talk about your employees, we have to get your employees organized in regards to who's coming back, who's not coming back in terms of the workplace, and maybe who's working a hybrid type of situation. And then we need to talk about employee health and resilience as it relates to not just your employees coming back to work, but how are they coming back to work? Are we getting all of them? Are they emotionally and mentally feeling safe as well as productive? What we're not going to cover today, just to be clear, is any leave of absence, any emergency acts that have been put in place, any compliance, and any employment laws. We're going to focus more again on operations, strategy, and for the purpose of today, mental health and well-being. So the assumptions, and this is the assumption, this is where we have to start in terms of context. This is a change management project. You are affecting change. No matter what you do when you're affecting change, it always causes a bit of concern, caution, possibly fear in terms of what is the change going to bring. And so this is a change management project. So that's how we have to kind of frame this. And then when we talk about the return to workplace, For some of you, you never left because you're an essential business, but some of you paused, went work remotely, started coming back perhaps, or thought about coming back, paused it. So it's interesting how we have received different information from different colleagues of how they are implementing the roadmap to return to the workplace. And the most important thing I can give you is continually check and reference the local health agencies for up-to-date guidance in terms of what's appropriate for you, not just at the federal or the state or the county, but even by the city level as well. And so what's important is this change is happening. And so we as HR leaders, business owners, we have to adapt to this new workplace, basically. And so we need to really lead the way and being comfortable with this change. And my team has heard me say this, that, it's right now, the mantra is to be crude and effective when developing new programs, not perfect and polished, because it is likely what you're developing today will continue to change. So think more bullet points and not narratives when we're drafting policy, instructions. Keep it simple, kind of crude and effective is the focus. And so partly because of this, no one knows when this pandemic will end or when it will return. There's so much going on right now in terms of the protests and lots of gathering and blowing up the gathering restrictions in terms of people coming together. We don't know what that's going to do in terms of the actual pandemic. So we will find out in the next 2 to 3 weeks. So be sure you continue to watch and go to your local health agencies. We're going to need new policies and process to develop and implement. And then we just have to continue on going with adjustments to make sure we're meeting the needs of our workforce. So those are the assumptions going in today. And before I talk about the project plan, I jumped right in. I want to make sure this webinar could not have been done without our team here at Bright Talent. So we have Renee Maurer, who's our head of operations, and Amy Watson, who's in charge of administration, as well as Miki Jo, who's our head of client engagement, in addition to being a health and wellness coach. We put a ton of time in developing this, so I get to be more or less the talking head and speaking to this material, but there was a lot of work going into this, and the team really helped, so I want to make sure I gave them credit. In terms of what we developed for you, when we think about a change management plan, it is a project, and so we developed a project plan around change management and the things that you need to be thinking about as you get organized to bring people back, as well as start implementing the new practices to have people in the workplace. And so we broke it down into 6 categories for you. We broke it down into policy, communications, by function, in terms of thinking by function, what are the needs? And then by function, what are the systems needs as well as facility needs? And then as we've implemented these new practices, we need to continually, on an ongoing basis, evaluate and adjust. And so you can find this detailed project plan on our website at brighttalent.com/pandemic support, and it's a very detailed project plan to help you get organized. We also provide you a project plan outline, and it really is in support of the project plan. So it takes those high-level tasks and subtasks, and then it actually outlines what you should be doing in those various categories to develop new practices and policies. And this is what the project plan outline looks like. And this could also be found on our website, and you can download this. Now, what's nice about the project plan outline is that we've added links to all the various agencies and resources you need to develop your program and your practices. So that's all in one nice place for you to go to and get organized and start implementing tools. And so really, when we talk about implementing new practices, when we talk about change management and implementing new practices to bring our workplace back, there's really roughly 5 practices that we really need to build around. And these 5 new practices touch policies, facilities, systems, and sanitation. As an HR person, I never thought I'd be talking about sanitation, but we are, because it's critical right now. And so all of us have to get educated on it. But I'm going to walk you through very quickly how these practices need to be thought of and how you need to roll these out. So we have the 5 practices on the left. We're going to have distancing restrictions. gathering restrictions, employee health and safety practices, infectious disease action plans, as well as remote work policies, practices. So when we think about it in an organized way, when we're putting these new distancing practices in place, of course, each piece I'm going to share here is not comprehensive, but an idea to help you start drafting and start thinking about how you're going to roll these out. So when we talk about distancing restrictions as it relates to policy, we're going to have to put 6 feet apart in all office spaces and hallways. So we're going to have to instruct people about this mandate. Gathering restrictions, we're going to have minimum capacity for meeting distancing, to meet meeting distancing. So if we had a office full of 20 people, we're now going to be at least half that size, maybe even smaller, to meet that distancing of 6 feet apart. Employee health and safety. This is a big one, a big topic for all of us. We are now wanting to make sure we are checking the health of our employees. So we have to put these policies in place as it relates to that, as well as we have to accommodate those that are immune compromised, or what we call the high risk category of 65 or older. So we really have to think about those practices as well. And then in terms of infectious disease action plan, we have to develop a step protocol to follow so that if an employee tests positive for COVID and they were in the workplace, we now have to react to that and get into a plan and develop that plan. And this has to be communicated to all managers as well as to all employees. And then remote work. A lot of us didn't have a remote work policy. So now we need to define that remote work policy, such as eligibility, who's eligible, and what are the expectations for performance as it relates to remote work. And then when we fall into the category of facilities, distancing restrictions, what does that mean? Well, we have to arrange offices to accommodate this, as I mentioned before. We have to have clear signage as it relates to gathering restrictions, clear signage that communicates to our employee base the limits to meeting. And then we need to, from an employee health and safety, from a facility standpoint, we need to have that symptom check at home or in the office before they come into the facility. And so what does that look like? A lot of people are checking their employees when they get to the workplace. We're hearing great success in some cases. We're not hearing very good success in other cases. It's a process, and it's difficult to implement change, affect change, and have consistency day in and day out. And so a lot of people are also asking employees to do a self-symptom check at home before they even come to the workplace. And so depending on your size of company and situation, that is one I highly recommend for companies that maybe don't have a large workforce or only have a professional workforce that doesn't necessarily have a production workforce. As it relates to an infectious disease plan, we have to communicate this to everybody in the office, managers and employees. And as it relates to remote work, as it relates to facilities, now we have a situation where people are working remotely, yet they might work a hybrid shift where they work several days at home, and then now they're going to work 1 or 2 days in the office. What does that workspace look like now? Where are we putting these people? Because it's likely they're not going to have an office to come back to, rather what we call hoteling type of spaces. Then when we start thinking about these new practices, what are the implications for systems? So for example, if it's a distancing restriction, we're rearranging offices. We just need to make sure there's power and connectivity so that people can be productive with their computers, or in some cases with the equipment they're using. As it relates to employee health and safety, if you're checking temperatures as they're walking in the door, you have to have these thermal devices. You have to know how to use them. You need to make sure that they actually meet the standards of why you're using them. And then in some cases, if you're using thermal cameras, you might have power needs to power up this equipment. So something, again, to think through. In some cases, you might be asking the employees to self-assess or symptom check at home, and you might send them actually an electronic thermometer so that it would be company supplied, and you have a reliable piece of equipment that you know is giving, hopefully, the same consistent results across all your employees. And then as it relates to remote work, as it relates to systems, we need to make sure we have collaboration tools and security in place so that we can really support remote work and making sure that everyone has what they need to stay connected and working with their teams, as well as making sure that we have the right security protocols in place so that our information is protected. And then when we think about sanitation, we think about gathering restrictions. When people go into a room, we need to have cleaning instructions. So for example, I'm hearing some offices are as strict as nobody is using the kitchen right now. In some cases, nobody's using the bathroom, so I'm not quite sure how they're managing that. However, if there's any area that they're using and that could be used by someone else, there are cleaning instructions and cleaning supplies to make sure it is sanitized. When we talk about employee health and safety, we are providing PPE, such as masks and gloves for all employees, as well as cleaning instructions if at their desk or if they're in these communal areas. And then infectious disease action plans, so that if a person tests positive in your place of work with COVID-19, what are we doing to lock down that space, any other space that person might have been in, and then how are we disinfecting and cleansing that space to assure an outbreak doesn't happen? So that's another thing we have to think about as it relates to sanitation. And then remote work. So if they're coming in and they're using communal area, such as a hoteling type situation, what is the cleaning regimen? So that's how we have to think that through. So again, we've walked you through the project plan of how to get organized. We've shown you the project outline in terms of how you're actually developing the tools and implementing. And then as it relates to just getting organized from the new practices that need to go into place and how they touch these various parts in implementation, we have now caught you up to this in terms of how you're going to implement these programs. And now we can move to how we think about the workforce. So after we've implemented all these new pieces, we now need to think about how are we actually handling our workforce. So I'm going to quickly walk you through a macro view, which is looking at your employees by function, and then also by employee in terms of the micro view, in terms of how are we handling each employee. So for any of you that might be on mobile devices, I apologize, it's going to be very hard for you to view. It is available for download on the website. So if you want to download that quickly and follow along, otherwise I'll walk the rest of you through this. So this is the functional view, and this is the functional workforce. And when we talk about a workflow, we're talking about how do we design and how do we organize and managing really anything, any process. And so this is a workflow design to manage the workflow as we're getting, workforce as we're getting prepared to bring them back. So the first question I ask is this person returning to the workplace? So let me move to the right. If they're not returning to the workplace, then it's assumed that they will be a remote employee. And then if they're a remote employee, the next question is the employee on leave? Because if they're on leave, which some are because they're caring for sick people or they're sick themselves, although I understand it's getting much, much better, so less and less are on leave. If they're on leave, we just return to our leave policy. If they're not on leave, obviously they're still capable of working. And so as an organization, we need to make sure that they have what they need to continue to work. We need to review, again, our policy, our practices, and then we need to make that come to the decision point of, do we need to draft policies in some cases because we don't have them? Do we need to update existing policies? If so, then we're going to work with the cross-functional team to make all the appropriate adjustments. And then we're going to come down and continually evaluate all of the practices put in place and communicate those practices to the workforce in terms of what it means to be a remote employee. So that's the flow for the remote employee. So now if we come back to the top, are we going to return to the workplace? And the answer is yes. Then now they're considered a workplace employee. And so once again, are they on leave or not? And let's assume no, they're going to come back to the workplace. We have to review it and draft the requirements. So we created this sub box that more or less outlines what we just shared with you as it relates to what a project plan looks like and developing all the necessary new policy and practices. And then once we define those, we need to communicate that to the employees as they come to the workspace. And then we also have the opportunity to always ongoing evaluate how we improve on these practices. And we're just going to continue in this cycle until we either don't need these practices anymore or they just evolve to something else. So that's what it looks like at the macro level. On a micro level, this looks at from an employee perspective. So when we look at an employee, the question is, are they able to work? And if they are not, then we would refer to our leave policies. And if they are, the next question is, are they returning to the workplace or not? So if they are returning to the workplace, we see, yes, we follow this flow, which is identical to the flow I just walked you through at the macro level, at the functional level. And so you would follow that process of making sure they know what is expected of them as they come back to the workplace. If they're not coming back to the workplace, the next question is, are they able to work remote? And if they are able to work remote, then you would walk through the workflow of all the necessary expectations and instructions on how to work as a remote employee. Where we need to be a little bit more sensitive and think things through is if they can't return to the workplace and they're unable to work remotely, then we need to evaluate what is this employee's status. If we want to retain this employee, then we need to figure out how can we change their role so that they could work remotely if they're unable to work in the workplace, example, the high-risk population. If there's somebody that we can't change their criteria, then we have to move down and update their employee status, whether they're on leave and continue leave, or you think about putting them on leave, or in some cases, maybe it's exiting from the company because we just are unable to accommodate. So this is how we need to think about our employee population at a functional level and then an employee level. So now we will move into the Q&A. And as we get into the Q&A, I just wanted to make sure I point out here that we have all of these resources available sitting here for you. So all of these are embedded in that project outline I shared with you, and they're also right here. So just as we're talking through Q&A and as Miki Jo gets into her presentation, just want to make sure you understand each of these resources are available to you. We have them in one spot. So, thank you, Jo. Thank you. Before we turn it over to you, do we have any questions?
We do have a couple of questions about health and safety or health and employees, but we can talk about that as we're chatting on that subject as well. But I did get another question just about, you made the comment basically when you were saying you saw some cases about temperature checking and so forth. You saw some things working really well on site, and then things not working so well on site. They wanted you to comment more on that. There wasn't a specific
elaborate more on that.
Yeah.
Okay. So we have a couple of situations. So let me just talk about where it works well. Where I think it works well is with the larger companies that have made investments into these thermal cameras. So no one has to get close to an employee walking in the door. The thermal camera is checking the person as they walk in the door, and that thermal camera is set up to 100.4. So if anybody has that temperature or greater, the employee is immediately notified, and then they're asked, to not come into the facility. And if they meet that, if they're 100.3 or less, then they're able to come into the facility. Very efficient. Also, that camera is very expensive, so it's mostly the larger organizations that are using that. The next bit of process is to literally have, as most of us have seen, have had a designated trained employee as a health checker as people come to work. They're taking one of those scanners that scans the forehead for temperature. The challenge with that process is companies have to, the people should be fully gowned, gloves, N95 mask, which is the more, I guess, commercial grade mask, and they need to get within, very close to that employee to provide all of that, and then they have to keep track of if a person does test positive, and then we have to ask that person to leave. That process has a lot of challenges in it. So if you're following that process at work, that's one that has to continually be evaluated and watched to make sure it's working, as well as the safety of the health checkers themselves is very important, because we've heard of different stories where it's not being executed as well and as consistent as it needs to be. So if you don't have a huge workforce, and you don't need them to come all the way into work to be checked, the other way would be to send a health, and you'll get into this, Miki Jo, you'll send a symptom check questionnaire to the employees, and they can check the symptoms at home, including their temperature, and then they have to get approved by the manager before they come into work. To me, that's probably one of the more efficient ways to execute the health check process.
Yeah, and there's a follow-up question to that, which is, anything specific that you can share about who is doing temperature checks? either HR or hired health professionals?
It's mixed. So we have a mixed bag. So honestly, I haven't heard of HR specifically doing it. I have heard of HR recruiting internal employees that are willing to do it. And then also some have hired nurses, like just interim nurses, to come and do the health checks themselves as well. So it's been mixed.
Yeah. And then here's another question. It's somewhat different, but it's a really good one. If I suspect that an employee is struggling with being on site or suspect that their work may be suffering because of it, what's the best approach on addressing the issue with them without offending them?
Sure. So that's a sensitive area. And so this is where we just got to, and if it's an HR, well, whether it's an HR person or a manager talking about this, what we want to make sure is that we're sensitive and we're accommodating people. However, a company can only do so much in terms of the health and safety and making sure they're following all the protocols. And we have to be sensitive for people's well-being and their level of stress or anxiety over this. And so we should accommodate them. And if that means they need to work from home a little longer than maybe you would prefer, that would be accommodating that. But at some point, there is a line where a person needs to come back to work to be productive. And so we just need to know what that line is. And the best way to do that is have just an open dialogue with the employee and just have that dialogue and be sensitive to it. And you know, sometimes it's a negotiation. Look, can you come back in a week? We really need you to come back within 1 week. So we're willing to give you a week to kind of work through this. So there is some lines though that you need to set up as an employer.
Yeah. And I'm sorry, good questions are coming in. We're kind of skipping back and forth. Another question, if employees are taking their own temperature, is there a concern about HIPAA confidentiality?
So this is really where it's a gray area.
Would you like me to take that one?
Well, let me share from what John Polson shared for the employment attorney. So checking a temperature is not a HIPAA violation, right? Checking a temperature and us knowing their temperature is not a HIPAA violation, especially what we do with that information, right? So we're not necessarily storing that information anywhere. If they do test positive, then Miki Jo will get into the whole organization of that, where we have to be sensitive of who knows that information. And so when you're checking an employee's temperature at a workspace and it's 100.4 or higher, and they're now going a different direction than the people are that are coming to work, you know, we get into this weird little gray area where that person now has to go home. So it's likely anybody around them, including you, know that they probably have a temperature. So we just need to be really sensitive to that and just protect that information as best as we can. And if we're doing it at home, the reason I like that is because less people are likely to see that and therefore less likely to be a HIPAA issue. And it's all about the process consistency. So it's all about process consistency and how we store that data. Yeah,
consistency in the process, right? Kind of across the board.
Yes.
And also, I'll be briefly showing you in a few minutes a COVID-19 symptoms questionnaire that if people do take their temperature at home, they log down what time they took it, what it is, and so everything's basically on record, and then they can, over the phone, they can get permission to come into work and whatnot. And I just did want to say it's not always possible for people to work at home, right? Depending on what their function is and the role is. So there's a lot of variables about that. And I believe over the next few weeks, aren't we going to be diving into some of those questions more deeply and more specifically, Brennan?
We can. Why don't we do this, Miki Jo? Why don't I take over the moderator piece and now introduce you? And then perhaps my hunch is some of those remaining questions that we have might be answered as you go through the toolkit, the implementation toolkit that you're going to show, as well as kind of the guidance behind that.
Yeah, I'm sorry. I'm just reading a couple. I'm just reading we've got quite the questions going, and I just don't want to leave anybody out before we switch over. So let's see. If other employees are checking colleagues' temperatures, is there a further HIPAA concern? Yes. So
if you have other employees checking other, yes. So there's so let's be clear. we're not just simply grabbing an employee and putting there and just showing them how to take a temperature. There's a protocol there, there's a process, there's confidentiality understanding. So there is training that has to happen. We're just not haphazardly making somebody a health checker. There is a process there, and especially around sensitivity of information and how to manage and retain that information. So
Yeah.
Good question.
And then this is a comment question on privacy versus productivity. I've heard some employers want to track employee computer activity as a percentage of hours, et cetera, to keep tabs on remote workers. Is that acceptable?
If it's a piece of company equipment and they are being paid for the company during that time, I don't know of any. It's no different than being on a company computer now. We basically, yeah, it's like a time clock. When we're assigned any type of equipment or we're being paid, employers can check on our equipment and communications.
Right. And it's also consistency, right? Either random consistency.
Good point.
Yeah, random over time or random over people. Or if you're doing it, 24/7, and that's the thing, you would have to almost do it 24/7, because if you're working from home on a computer, you can be working all kinds of hours.
Right.
So just as long as you come up with a policy that's consistent and legal.
Yes, and that was my point in the matrix there. The thing I said about policy was eligibility and expectations. So part of the expectations of working remote means you are going to be tracked if that's your policy for your company.
Yeah. Great. So there are a couple other questions, but it kind of leads us into the health safety area and the kind of mental wellness at work kind of area. So how would you like to segue into that, Brennan?
So I will segue smoothly. So we'll just segue. While I stop sharing, I will then introduce you, and therefore you can share yours, your presentation. So as I mentioned at the beginning of this webinar, employee health and wellness and resiliency has become, I think, more emphasized than ever, even 3 weeks ago when we started talking about it. Miki Jo was with us just before the Memorial holiday, and so much has happened since then. We thought, you know what, this is so relevant. Let's do it again and dive a little deeper in the toolkit we developed for you so we can show you where you can start gauging and helping your employees evaluate how they're feeling, what they're feeling, how to communicate that. And so that's why we've invited Miki Jo back. So I'm so, I guess, what's the right word? I just feel so blessed that Miki Jo is affiliated with Bright Talent. She is our head of client engagement, but she's also a certified and educated health and wellness coach with her own practice. And so she is taken all that expertise, but she's she's a former practitioner, head of HR, head of talent acquisition, head of learning and development. And so she's taken all of that experience and she's developed now this practice that is really, I think, really unique, as well as just a really good tool to show you how to do this. So how to do the employee health, wellness, and resilience. So with that, I will turn it over to Miki Jo.
Thanks, Brennan, and I'll let you do your computer stuff now. I just wanted, I'm not going to talk a lot about myself. Brennan just did a great job. But what I really wanted to do was build a practice of blending both the leadership development that's so important for us as leaders and for a company with the health, well-being, and transformative resilience. Because I think, our commonality on this webinar is that we're all have HR backgrounds. We all have strong HR backgrounds, and people are a part of what drives us and doing good for people. And so that's just the baseline of why I wanted to blend those things. And I have been blending them successfully for about 7 years now. I've worked with, just because I've been doing this so long, thousands of leaders and managers and even entrepreneurs, but I've had a real focus in HR because that's my background and that's the language I speak. So when this came around, I felt like part of what I could do, and that what Brennan and I could do together, is that we could build these implementation tools for you. Because ideas and discussion are great, but do I have something that I can take out of this and use right away? So as you can see, Brennan is focused on that in the change management, and I've tried to add to that with the health safety. Really quick, I want to answer one question. Somebody wrote, to what extent are your customers' clients looking at healthy buildings certifications such as WELL or FitWell, as well as surfacing of building space conditions to occupants to not only ensure health and safety, but to retain and attract employees and customers? So it depends on what businesses they are. I have heard mostly food service and facilities businesses and commercial buildings, and you know, more towards the real estate. I have heard much more of that going on, and I've actually gotten some best gotten meaning acquired some guides in what's going on in those industries. I can't share them specifically, but I just wanted to also see what was going on. So quite a bit, but specifically in industries that are most affected by their responsibilities, I think, in commercial buildings. I would love for you to email me more if you have any more questions about that. My email is Miki Jo at brighttalent.com. All righty. So I just want to dive in now to this toolkit that I've developed for you. You'll get a link to this right after, right, sometime today, I should say. And let me just share my screen here. Sorry about that. Okay. And let me just put this on slideshow. That way I can go through it quickly. Okay, so this is a free premium or a free toolkit filled with premium resources. And inside, you won't find any sales pitches, but you will find a link if you want to share it with anybody. How you get here, if for some reason you missed my email, is healthisaresource.com. And right on the first page, you'll see that this is a link that will take you to it. The toolkit has two sides, or two different parts. And one part is the health safety, and that's specifically for HR leaders and for organizations. The second part is for your personal resilience and well-being, and or any other leaders and employees that you want to share it with. Right now, I'm just going to focus on a quick look in this, because once you get into the toolbox, you'll actually see more in-depth videos that will take you in and help you understand what's in there a little bit more in depth. So the main thing that you'll want to know is that there's two sides have been considered in the health safety workbook. One of them is the responsibilities of the employer, of the organization. So these are planning and implementation tools for the workplace health safety. And then the other second purpose for this is there's a couple questionnaires for you as an employee, meaning anybody in the company that's an employee that HR can share these questionnaires with, and they're self-driven questionnaires, meaning they're self-checks, so that I can check on my own health and my own resilience as an employee. Let's just go through a couple of things that you'll see in this master workbook. It's in an Excel, but you'll also get versions in PDF and Word. So again, they're as close to ready to use as I could make them, with just a little bit of adjustment from you. So you'll see roles and responsibilities, particularly here. This will list what tools are available for what roles: human resources, internal communications management, employees. This really spells it out all the way across, from this health safety perspective that Brennan talked about earlier. So you'll see all along here, from supplies, physical distancing, even health and resilience awareness. These are the list. Now, we know that you're already working on all this stuff and you're not just beginning. You've been thinking about this for a long time. You probably have some things in place already. Think of these tools as a gap checklist to for you to look at and your teams to look at to make sure that the quality of your thinking is consistent kind of across the board. So you see, we have these different checklists: supply, planning, disinfection, worksite entry, distancing visuals, planning for that, and the all-important communication and endorsement matrix. This is what some of those look like for you. Again, they're built to be a gap checklist, that things are complete, incomplete, or you need to update it because some changes have been made, etc. And I also wanted to share that this workbook has a combination of resources that come from really great references. Like this one comes, well, this isn't exactly like it, but the origination of the checklists that are here were originally in the documentation for GM's Return to Workplace playbook. So, you know, these are coming from great places, great resources, and by the way, with permission. So we did develop this one internally. This is the communication and endorsement planning matrix. And then we have ready to use questionnaires for you. So this is the COVID-19 symptoms questionnaire that has been adjusted just a tiny bit, but was originally created by Fisher Phillips, labor law lawyers, I'm sure you're familiar. And this is the one that actually has a second page and has a second page for shift workers and if they take their temperature at home. So I think that'll be useful. And then health and safety tour for your managers, supervisors, or anybody else that you trained to go around and make sure that all of your disinfecting instructions and policies are being consistently and mindfully, implemented. How's that? We have, now these are self-check questionnaires for the employee, meaning these are you can either print them from Excel or from Word and PDF. And these are for the employees to use themselves to check their own health and wellness. And just by taking these, they will learn more about the factors for their own resilience. And then there's a little bit of guidance at the end of each questionnaire on, number one, again, if you have any COVID-19 symptoms, what to do and to follow your company's policies. And then if they have other symptoms or they have other concerns or things that are taking them out of balance, just to be aware of that, and a couple of questions that may help them come back into balance. Now, there's a number of tools for them to use in this toolkit if they find that there's areas of or factors of resilience that they'd like to increase for their own well-being, because that means not only will they have more energy and be able to perform better, but they'll be mentally calmer and be able to focus better. And so this is just a quick picture of the Resilience and Wellbeing Toolkit. There's a little bit of a deep dive in each of these areas. Inner resources and transforming stress is about using their own internal strengths. So we're really familiar in HR with using our internal strengths for performance. And this is how do you use them for your own well-being. Then rediscovering calm center and feeling expansive. And then, yeah, a little bit about food and taking all that complex information we hear in the media about food, getting to a simple principle about how can I help myself with food. We have lots of step-by-step discovery guides. We have a focus on heart-brain coherence, and some of that's meditation and some of it's other self-discovery guides. But what this does is it helps people's resilience muscles grow stronger. And then here's the food part. So just want you to know, if you do share the link, when somebody goes here for the first time, not you because you've already shown up to this webinar, so you'll get a direct link because we already have your information. But if you do share the link, people will have to fill this in to get access. Again, not so that we can sell them anything, just so we can see who's using it and then be able to make either videos or help them get more out of the toolkit. All right.
Awesome. Thank you, MJ. I appreciate that. And so we have a few questions that I want to run by you, and they were, I think some were left over, but I think they are best answered by you. So the first question that came in, do they need a doctor's note to return to work after screening higher with a temperature?
Higher, I'm not sure what you mean by higher.
So I think what they're saying, do they need a doctor's note to return to work after screening with a high temperature?
Oh, a high temperature.
So if they're 100.4, they get sent home, or they check at home and they're not coming in, do they need a doctor's note to return?
The simple answer is yes. So that's a simple answer. If they have gone over, or if they've gone at or above the temperature that you set, that the CDC recommends, I would say yes.
Mm-hmm. And then I think the add-on there is if they're not going to the doctor because of fear of going to the doctor, then you need to wait the 2 weeks that they are no longer symptomatic, and that 2-week clock starts from when they no longer have symptoms.
Yes.
And that's what we learned from our Pizza Hut Hut COO and their infectious disease plan. And if employees are, I'm sorry, we already addressed that one. The question, did we address this? Did we already ask this, Miki Jo? Some higher tech companies may institute tracking and tracing of employees and their conditions. Would imagine employees would resist this as too invasive to privacy. Also, conversely, some companies saying that in a leased building, the tenants won't do entry screening, but insist that the landlord take care of that entry point lobby. Comments. So there's a couple of big questions here.
Yeah.
So some, and it's kind of quotes, higher tech companies may institute tracking and tracing of employees and their conditions. Let's address that.
Yeah, so that's pretty broad, but what I will say, without knowing more about the details of what's driving that question, is HIPAA, there are still HIPAA compliant regulations. And so there's a fine line. Companies are able and should be giving the COVID symptoms questionnaire. And that is, you are legally able to do that. You're encouraged to do that. You should be doing that. In regards to other conditions and symptoms and things, in that health self questionnaire that I was mentioning earlier in the toolkit, there's a couple of ways to do something like that. You either, as HR, we can either share those questionnaires, and we cannot administer those questionnaires, meaning we cannot be there with them, and a manager should not be there with them. It really is for employee awareness, and then maybe providing some resources. They could just be connections and links, or they could be on-site resources, depending how your company is taking care of things, to help people who are aware of symptoms, or just feeling really imbalanced, maybe nervous, maybe anxious, various things that might come with return to work. You can provide resources. Here's something that you can do as a company. So I'm not pushing this, but let's just say a company came to me and said, I want to get a real beat on conditions, anxiety levels, productivity, how productivity is being affected by how people are feeling at work, emotionally, mentally, or physically. What a company like mine can do is we can administer it online, this health self-checklist, this resilience self-check, and the company can get reports that are anonymous, but they can get some aggregate information that they can get a real beat on maybe where to invest their dollars if they're going to bring wellness people in, or put together a wellness program. So.
And just from a compliance standpoint, just like any other employee health information, if we're asking a person about their temperature and it's less than 100.4, nothing's tracked. If the person tests at 100.4, we now document that information and we store it in what we normally store in, not personnel file, but health file, we would store it there. Now, if the person tested positive and then they were actually inside the building, that's where some tracking and tracing, we have to do that by liability to let those know that might have been exposed. So that's when tracking and tracing comes into effect. And then go ahead, Miki Jo.
I was just going to say that's absolutely true. And also our instructions, if we're having people take their temperatures at home, the instructions on what to put into the form has to be very, very clear. So they're not accidentally giving HR information and making us liable for something we don't want to be liable for.
Right, exactly. So this is where that separation of personnel file and health file has to be followed. And then as it relates, then the next question to that was the idea between tenants in a leased building and what the landlords are mandating versus what their tenants are mandating. And so ultimately what I've heard is you have to follow the landlord's lead. And if the landlord is not allowing you to go into the bathrooms, is not allowing you to use kitchens or those types of things, you have to decide as a company, is it worth it to come back yet? Whereas if they're putting it in the responsibility of the tenant, and then you're really going to be in an interesting scenario because each tenant then is going to have their own protocol or policy to follow. So I think that's something each company has to decide on their own, what is the right decision for their company, their culture. And so the point behind that is perception, right? Employees are perceiving as to whether or not their employer is taking this seriously or not, and what protocols are being put in place or not. And I think that is also driving how safe they feel about returning to work or not. So that's kind of a big question. However, that's how I would respond to that.
Yeah, do you have a resource? Do you have a resource for that, a legal resource for that? Do we have one yet?
You know, I don't, and I really, that has been shared with me through just verbal people giving me that information. I don't have any documentation.
No, I didn't. So, yeah, I didn't mean documentation. I was wondering if we had a link because I have gotten a couple of books on that I'm not supposed to share, but I am looking for a link for that because legally things can be changing on that and shifting every couple of weeks right now.
Yeah.
So I think that's on us. We should look for that.
Yeah, I was just going to say that's probably a good follow-up for us. We really don't have, I think, solid information on that. So great question. And then the next question and probably last question, what, if any, are the top 3 concerns of employees who state they don't feel safe returning to the workplace?
Yeah, so that's a great question. And I think number one, from what I've gathered, and so, you know, this is like anecdotal because I'm talking to people who are returning to the workplace. I'm talking to a lot of HR leaders. I mean, Brennan and I are, we all are. And one thing is just peace of mind. So I was thinking about this morning, and I was thinking how we as HR people, especially when there's something big going on and we're thinking about communication and endorsement, we can be, and rightly so, sometimes a little heavy-handed on really focusing on the message of compliance. And that doesn't always, on the employee side, make them feel or give them peace of mind. So I think that we both need to, when we're thinking about the communication part, thinking equally in the message, yes, compliance, and equally what can be an appropriate but compassionate message so that they really understand that we care about each one of us because we're all employees too of the company, you know, that we really are caring for each one of us and that we're spreading the message to care about each other, because peace of mind comes from not only seeing and watching that disinfection practices are in place and being practiced, but the caring part, that will go a long way. The other part was, I was thinking about, it would be great, and I'm sure some companies are already doing this, I haven't heard of one yet, but to set up a hotline for if they see, you know, an area that's in disarray or it doesn't look like it's being disinfected, or they just blatantly see people not disinfecting when they're supposed to be, and not to tattletale, but hey, I'm concerned about this area that I use. And then having the cleaning staff or whoever is fit. And when I say fit, I mean, you know, head to toe fit to go do this kind of sanitation, to kind of make a bit of a public display, you know, just go during the work hours, let people see you cleaning. I think simple things like that will go a long way. So that's one. The second part is, and I'm going to just use the word anxiousness or concern. And it's not even about anything specific. It's not about me being worried about my manager or me being worried about even my employer or the company. It's just this underwriting feeling of anxiousness. And this is the kind of feeling, and it may not seem like it's taking over my day, but it's kind of like the background noise all the time. And this is why we have the wellness tools that I wanted to provide those for free, because we can't always talk ourselves out of feeling this kind of concern, this background noise. And so we give you other tools to deal with that. So anxiousness. And then the third one really is about privacy. You know, what do I need to reveal about what if I do get COVID-19 and whatnot? So communicating your policies around that, I think will go a long way with the caring part. I hope that helps.
Yeah, and I would just add transparency, right? Transparency by the company, to your point, and perception. And just real quickly to touch on even something like mask wearing. And we heard from John Polson, the employment attorney, and I thought he said it very well. Socially, mask wearing is controversial. However, from a practice and a policy, it's something you're going to do right now because it's recommended by the CDC. So it's kind of like a restaurant, no shoes, no shirt, no service. So if you're coming into the workplace, you wear the mask. And if you're walking in a communal area, you wear the mask. If you're sitting in your office, no need to wear the mask. And so ultimately, sure, it could be socially controversial. However, right now we are implementing this mask wearing, and as an employee come back to the workplace, that is the expectation.
Yeah. Well, and I don't know about your county, but in San Diego County, we have a San Diego public health order that basically mandates the entire city to wear masks in any public areas or any public work areas. So we're supposed to be by law.
Right. From an employer perspective, an employee perspective, get it. So okay, that is all the questions we have, and we ran well over time. So just so grateful again, all of you are here. Thank you for being with us. I just want to share with everybody, hey, we're all in this. We're all learning on the fly. We're going to continue to host these webinars with new information every Friday. Next week, we have the VP of HR for Aurora Packaging, and they are a global packaging manufacturer. They never stopped working. So we're going to have the head of HR here to share with us what her journey was like while implementing literally on the fly all these new practices. So I'm really excited to hear from her, and I hope you come back to join us. Miki Jo, thank you so much. As always, it's so good, and hopefully everybody takes advantage of that toolkit. I think you'll find it unique and super helpful as it relates to implementing these new practices. So everybody have an awesome weekend, and we will hopefully see you next week.
Thanks, everybody. Bye.
Bye.